Welcome to the Invite Health podcast, where our degreed healthcare professionals are excited to offer you the most important health and wellness information you need to make informed choices about your health. You can learn more about the products discussed in each of these episodes and all that Invite Health has to offer at www.invitehealth.com/podcast. First-time customers can use promo code podcast at checkout for an additional 15% off your first purchase. Let's get started.
The rate at which diabetes, obesity, and other metabolic disorders are on the rise in this country, it's no wonder why many people are seeking out different ways to improve upon lean muscle mass, to help to enhance their body fat ratio. These are all things that are certainly important when we talk about the way that fat is distributed throughout the body and how much of an impact, especially a negative impact, if we're carrying around too much excess weight, especially through the abdomen. Now, this has been known for a very long time in both men and women that when you carry too much excess belly fat, that actually really generates a significant risk when it comes to cardiovascular disease. So wouldn't it be nice if there was something that came from nature that would be supportive to targeting that belly fat and something that is providing antioxidant benefit throughout the body that can help at that cellular level, something that has been shown to help to support the liver. So when we think about all of the benefits of something such as that, then I think it would be wise that we speak about that. And that is exactly what I'm going to do today. I'm going to talk about CLA, which is conjugated linoleic acid. Now, this is really quite interesting, the way that CLA has been researched throughout the scientific community. And I want to talk all about that across the spectrum as to how it's been looked at and shown to be quite effective for targeting many different problems that can arise through the aging process in the setting of chronic diseases, and at the same time, a lot of focus on healthy weight. So I am Amanda Williams, MD, MPH, and let's get right to it. Let's talk a little bit about CLA and what exactly conjugated linoleic acid is. Now, we look at different fatty acids and things that we're exposed to. We talk about like omega-3 fatty acids, for example. But what we know about conjugated linoleic acid is this is basically, it's kind of a collective term used to designate a mixture of, it comes down to the actual position or the geometric isomers of linoleic acid. So we're looking at that conjugation. So it's the actual structure of that specific acid. Now, one thing that we know about linoleic acid by itself is that can have the tendency to be pro-inflammatory, so actually driving up inflammation in the body. But we know that when it's in its conjugated form, it actually does a significant amount of benefit when it comes to lowering inflammation, which is why I want to talk about it in quite extensive detail today. One of the big drivers for CLA in terms of just public knowledge of it is because of the obesity pandemic that we are dealing with, not only here in America, but throughout the world. And there was a lot of early research where they said, could this potentially be that we actually lack CLA? And this could be a driving force, that if we have a CLA, conjugated linoleic acid deficiency, that this could be the reason why we are more prone to greater fat deposits throughout the body and less of that leaner muscle mass. So I do think that that's really quite interesting. A lot of the original studies that came out with that were looking specifically at the levels of CLA. And there was a interesting study that they did over in Norway many years ago looking at CLA supplementation. And when they gave people CLA, that the subjects in that study actually lost up to 20% of their body fat in 3 months without even changing their diet. And so we can say, okay, well, is that an isolated incident? Well, we have to know more about it in terms of, what was the starting point in terms of the obesity within their test population. We also have to look at their diet. And in general, in Norway, their diet is much healthier than what we see here in the US with a standard American diet. But we know a lot of different things now about CLA. We certainly know that it plays a really important role when we talk about thermogenesis, or that natural fat burning, which is why they've kind of really put it to the forefront of being beneficial for those who are looking to try and shave off some of that excess belly fat. Now, is this something that happens overnight? No, certainly not. Because remember, we are trying to play a game of catch up in a sense. Because if we have lacking amounts of CLA already existing in the body, plus we have the issues with insulin resistance occurring, and we have, improper transport of glucose throughout the body, and we have improper cholesterol transport. These are all reasons that can actually exacerbate that building up of fat deposits throughout the body. So that's just one thing to always consider. Now, the other thing that I like people to recognize about CLA is that it actually yields a really powerful antioxidant property to it, which is why it's been looked at in the setting of cardiovascular disease and looking at its benefit for targeting oxidation that can be very detrimental to the heart and as well as the blood vessels. So a lot of research out there looking at how the dietary conjugated linoleic acids could actually reduce plasma lipoprotein levels. So when we're talking about the bad cholesterol, so your VLDLs and your LDLs, which is the low density lipoprotein. And they found this when they were looking at disease states such as atherosclerosis, looking at high cholesterol. And for me, I found that really quite interesting because, initially a lot of that research was looking at body composition and the effect of conjugated linoleic acid on the body. Is this going to help in terms of burning that belly fat away? And study after study has shown this to be the case. And we recognize that the effect of CLA on body composition appears to be due in part to that reduction of fat deposition. And it helps to increase the body's ability for lipolysis. So what does that mean? Lipolysis is the breakdown of fat cells, where, say, if you have adipogenesis is going to be the creation of fat cells. So we want to try to avoid that adipogenesis. We don't want to be creating fat cells, but we certainly don't mind that lipolysis process of removing those fat cells and helping to support a better body fat ratio. So if one were to be supplementing with CLA in the goal of having that lipolysis process occurring, how much would one want to be taking? Well, certainly the science in human clinical trials show that the sweet mark is about 3,000 milligrams of CLA per day. So when taking that, you could do, 1,000 milligrams with breakfast, 1,000 milligrams with your lunch, 1,000 milligrams with dinner, but it really kind of depends on how it is that your meals are divided up. If you kind of just have two heavy meals for the day and a couple of lighter snack type meals, then you'd want to take maybe 1,500 milligrams with one meal and 1,500 milligrams with the other. But 3,000 is really that point that you want to get to start to see those types of benefits over time, because the goal is we're trying to help to promote healthy body composition. We're also at the same time helping to support a healthy immune system function, because remember, we're utilizing the CLA when it comes to its antioxidant benefits, when it comes to helping to support a healthy insulin response, when we look at the promotion of fatty acid oxidation in the liver, so even to support normal metabolic detoxification. So all of this is certainly a added benefit to the CLA. Obviously, most people are looking at it in terms of helping to encourage the breakdown of fat, but we do know that a lot of the early research with CLA was looking at it in the setting of even cancer research, for example, and recognizing that because of that difference between adipogenesis or lipogenesis, doesn't matter which way that you want to call it. Adipocyte is your fat cells, or we can call it lipids. So if we have adipogenesis, we know that that actually can become problematic when we're looking at the promotion of tumor growths. But we know that that lipolysis, so the breakdown of that fat, is actually beneficial because it can help to inhibit that tumor growth. This was all published in the Journal of Nutrients last year, talking about conjugated linoleic effects on cancer, obesity, as well as atherosclerosis. So really kind of some interesting info out there when it comes to the way that conjugated linoleic acid is working. But where much of the true interest, like I said, comes down to, if I take this, is this going to help in terms of, fat burning and weight loss? And all we can do is look at the science behind this. We know that LSU, so Louisiana State University, they did some animal studies with CLA, which was really kind of impressive. And they found that in just 6 weeks, they had a reduction upwards of 50 to 80% in terms of lowering the body fat. And specifically what they were looking at was the abdominal body fat. Now, there was another study that was done at University of Wisconsin. Once again, this was an animal study, but it was quite interesting. They showed upwards of 60% lower body fat and an increase by 15% in lean body mass when they had the exposure to CLA. So a lot of kind of really cool initial studies that came out with CLA, which is really why so many researchers really kind of gravitated to it, because it's like, wow, it's doing this in animal studies. Is this going to translate and correlate over to looking at humans? And certainly the science in humans is just as impressive. But I always tell people that when it comes to any type of supplementation, you always have to be regimented. It's not one of those things where it's like, okay, I'm going to take CLA and I'm going to do 1,000 milligrams once a day for a week and expect something's going to happen. No, this is something where, remember, we're looking at more of a metabolic regulation of CLA in the body to help to promote all of these positive effects. And so with that, we have to be consistent. We have to be on a regular basis, taking it every single day with our meals and sticking with it. And what is the timestamp that you put on it? Well, some of the initial human clinical trials indicated maybe at that 6-week mark is when people started to see a difference. For others, it may be 8 weeks or beyond. There are certainly people that I know who have utilized it and seen the difference within 2 weeks. So there's a lot of variables. Remember, each person's different. A lot of it comes down to lifestyle modifications that go in conjunction with this. Are you exercising? Are you choosing the right foods? Are you trying to do other things to allow the body's, physiology to work the way it's supposed to help the CLA enhance that fat burning ability? So definitely go to our website and check it out, CLA. And like I said, the science behind CLA, from liver health to looking at it for its antioxidant benefits, for the support of healthy blood glucose response and helping to enhance insulin sensitivity. A lot of different ways in which CLA can certainly be a lovely addition to anyone's supplementation routine. And that is all that I have for you for today. I just want to thank you so much for tuning in to the Invite Health podcast. Remember, you can find all of our episodes for free wherever you listen to podcasts or by visiting invitehealth.com/podcast. Now, do make sure that you subscribe and you leave us a review. You can follow us on Facebook, Twitter, and Instagram at Invite Health, and we will see you next time for another episode of the Invite Health podcast.